Today we will present a case of tooth 27. This dental element is, as you can see, quite compromised. The restoration fell some time ago, infiltrated, and over time a lot of debris entered there. This situation is very common among people who often end up having a small fissure in the restoration. So we removed quite a bit, a lot of material, a lot of debris and decayed tissue from this tooth. It keeps everything in there. If you eat rice, beans, if you eat salad, there's a little bit of everything in there. Can you imagine the amount of bacteria that is inside there? So we are curetting, cleaning that area. There's even a little more decayed material there. The drill is opening it up, right? Opening the dental chamber so I can access the pulp chamber. I am cleaning all this tissue because this tooth has already been diagnosed for endodontic treatment, as I showed in the X-ray at the very beginning. So I accessed the beginning of the pulp chamber and placed anesthesia there. This anesthesia is a bit painful and gives the patient a slight sensation of pain, but it is slightly important for me to make a complete access and also start to carefully and thoroughly remove the nerve portions from the tooth. So I am removing a bit of the nerves, also checking if the anesthesia has taken properly, if the tooth has good vitality. And even though the tooth is very decayed, like at the beginning, this tooth can be saved. As you will see at the end of the video, I am still carefully accessing the pulp chamber, removing the roof of the pulp chamber. I access the canals. The 3 canals of this tooth are shown in red, which I am filing and removing the nerve, which is the sensitive part, the part that the patient feels a lot of pain. Can remove a lot of the nerve and we start to clean the process. Clean, wash inside to remove the bacteria using hypochlorite with solutions that remove and eliminate the bacteria inside the canal. With these files that I am placing in the canal, I won't show you how I do it, but I am performing odontometry. For those who don't know, odontometry is exactly the moment when I discover through a radiographic image the size of the canals. The radiograph of the dental is here and then I continue the instrumentation from there. Now using the ProTaper system, this system can be various, right? In my case, I am using the rotary system to perform the endodontic treatment, right? Removing the pulp, preparing the interior of the canal, and giving it an appropriate shape to be able to perform the filling. These are the absorbent paper cones that will suck up all the liquid inside there within the canal. And now entering with the gutta percha. The gutta percha fills the canal. This is the actual canal treatment. It's when I carefully follow all those steps up to this moment of the filling. When I carefully place these thermoplastic rubber bands, I then carefully remove them with a very hot material using a warm instrument. I am carefully closing this first stage. This patient will return to me later. I am closing with the temporary filling and he will return to me for the second stage of this treatment, which is the prosthetic stage. Here is the picture, now without the sheet. This tooth is now entering the laboratory phase and the prosthetic phase. So, let's remove the material I placed, the temporary one. I will access the canals again that are no longer vital. They are perfectly filled. I am going to perform a procedure that many patients are unsure about. They don't quite understand why you fill a canal and then remove part of the filling. Removing the gutta percha with a special small drill, the gates, we take out a part, about 2/3 of this material that we filled, so that the metal cores can be introduced there. In my case, I had already taken the measurements, and you will notice that I opened the canals there and removed the residue to an appropriate height to place these metal cores that will reinforce our work, our treatment. Without the metal cores, this prosthetic work, the crown you saw at the beginning of the video, will not be possible. They provide the reinforcement and support for this tooth. Now, let's apply an adhesive with acid conditioning inside the canals so that these pins can be cemented. And now placing the cement inside the canals, the proper cement, And the adjustment of the pins, did it tremble a little there? Hit the camera there. Placing the pins. These pins are metal cores, already prefabricated, for which I had already taken the right measurements and worn them down. I do this in real time. I didn't show all the steps, because there are many very repetitive and detailed stages, and you might get distracted. This white stuff here is an opacifier to completely prevent the metal from showing at any point during this work. You will see that we carefully apply the white opacifier and add a little bit more cement there to shape and properly support these pins. Now I am preparing a part with an Ivoclar resin that matches the color of the tooth to ensure everything looks nice and white for the patient. So when they receive the crown, there won't be any dark spots from the work. This is done thoroughly and meticulously to ensure absolutely no imperfections. So I applied the Ivoclar resin for what? So that I can now proceed with the wear. That's it, folks. Let's do the wear now on the worked part. These wearings are necessary so that we can shape it to make the crown. The support is a preparation that supports the crown. I am applying another layer of opacifier. The patient needs to be anesthetized at this moment because I am going to make a mold now. In this molding, I need to retract the patient's gum. So I use a little retractor thread. You'll see it's ultra fine. That I use this little thread already, soaked in a hemostatic solution to prevent bleeding and pain. And then I place this little thread in the gum. When the patient is anesthetized, they do not feel pain. And I need this space to make a good impression, placing the crown deep down so that the end of the crown is not visible in terms of aesthetics. I'm changing the material I really like, which is the Optosil Xantoprem condensation silicone. It involves a double molding process, and this molding shows the preparation correctly, whether everything went well or if there were bubbles. I'm showing you how I do this work. From there, it becomes a plaster mold, and from the plaster mold, a crown is made. And here is our work. The crown was made with a ceramic resin. It is not ceramic and it is not resin. It is a mixture of the two. It is a hybrid. It's a job that I do in the laboratory, and it turns out like this, nicely fitted, perfectly, so the patient can go back to eating and chewing. Look at the beginning and then look later, folks. It is possible to treat. It is possible to save several dental elements. We just need to know how to properly indicate the treatment, okay? Final result, I hope you liked it. If you did, give it a like, comment, subscribe to the channel. A big kiss. See you next time.